WASH clearly has effects on health and nutrition, both directly and indirectly. The direct effects of WASH can be through effects on diarrheal disease, intestinal parasites, environmental enteropathy, and others. WASH activities also can affect health and nutrition indirectly through time and distance required to get to water sources, sanitation facilities, diverting mothers' attention from childcare to other activities. And in this webinar today, we'll be looking at an overview of the relationship between WASH and nutrition, key lessons learned, and recommendations for WASH programming going forward. We'll have a specific example coming out of growth through nutrition research, looking at findings and lessons learned on water supply schemes and further recommendations going forward. We are fortunate to have two distinguished presenters today, and I'd like to introduce both of them at the same time. Mr. Jason Lopez works with Save the Children US and is a specialist in water, sanitation, and hygiene. He provides technical support to growth through nutrition. His main areas of work are WASH for nutrition and WASH in healthcare facilities. Jason just recently contributed to the development of USAID's WASH and its link to nutrition technical brief, which is part of USAID's advancing nutrition activity. Jason is also currently working on providing support for multiple WASH activities in healthcare facilities, particularly in response to COVID-19. We have so little information on this that this is wonderful that this activity is going on. The second speaker is Dr. Abdul Halik, who has a Bachelor of Science degree in Public Health from Hawassa University, a Master of Public Health degree in Epidemiology from Jimmy University, and a doctorate from Ghent University in Belgium. I got to know Dr. Abdul Halik very closely, working with him in the Growth Through Nutrition project. He is the research manager for Growth Through Nutrition, and in this capacity leads the design, implementation, and analysis of project research studies, and authors many, many studies. I've lost track, Dr. Abdul Halik. At the latest I've looked at, I think you've published more than 25 research articles in peer-reviewed journals. And with that, I would like to turn over the presentation to Mr. Jason Lopez.
Hello, everybody. Good afternoon. Good morning. I'm Jason Lopez. I'm a WASH senior specialist with Save the Children, and I'm here to discuss WASH for nutrition, including best practices and current research, along with some lessons learned and recommendations from the Growth Through Nutrition project. All right. So here's our agenda for today. Starting with Save the Children in Nutrition and WASH. So quick overview. So global health. So Save the Children has several global health thematic areas, including nutrition, and of which water and sanitation is a cross-cutting theme. So we are cross-cutting amongst nutrition. Save the Children also has multiple nutrition programs around the world, and most of them do include WASH. Bit about the WASH burden of disease. So in low-income countries, WASH is 10.7% of all under 5 disability-adjusted light years lost or morbidity. These mostly from enteric infections from unsafe water, unsafe sanitation, and hand washing. In Ethiopia, WASH is 14.96% of all under 5 morbidity. Again, 10.9 for safe water, 8.5 for unsafe sanitation, and 4.27 for hand washing. And hand washing, remember, also has an impact on respiratory infections. So enteric infections, including diarrhea, went from the 4th highest cause of under 5 morbidity in Ethiopia in 2009 to the second highest in 2019. Enteric infections associated with malnutrition are 11.18% of all of the under 5 morbidity in Ethiopia. Now, a bit about stunting and WASH. So most of you would be familiar with stunting. So this line right here is the median height of an 8-year-old who's not considered stunted, and the children in this photo are 2 standard deviations below that median height and are considered stunted. So stunting is correlated with lifelong health, education, and social economic outcomes, including increased child mortality, increased exposure to non-communicable diseases later in life, delayed cognitive outcomes, lower school attainment. Latest estimates suggest that the average country's GDP per capita is 7% lower than it would have been if none of its workers were stunted in childhood. So what factors explain child height deficits and stunting? So these are all estimates, and I'm sure so for nutrition, the differences in nutrition are about a third, account for about a third of stunting. Diarrhea, the presence and absence of, is about 7 to 16%. And WASH services, independent of diarrhea, so such as latrine access or water access, are about 35 to 55%. And then research is ongoing on this. Just to keep in mind that it means that all these issues need to be addressed together to address stunting. So many of you may be familiar with the SHINE and WASH benefit studies. These examined infant young child feeding practices and WASH both together and separately, and their impact on stunting, anemia, and diarrhea. The study found no impact on stunting or no impact on these outcomes, with the exception of Bangladesh, where they saw a reduction in diarrhea. A few considerations from these studies were that they did not address all the environmental risk factors within the household. They didn't reduce infections. And in Bangladesh, they already had a high coverage of sanitation to begin with before the study. In the end, these studies have resulted in some rethinking of how WASH is implemented, and needs to improve health outcomes, which we will review in this presentation. So just to give you an idea, these are incremental WASH improvements. However, the line for child stunting prevalence doesn't follow that same track with incremental improvements. In reality, there's a threshold that needs to be met of cleanliness or WASH access to see reductions in stunting. There are several research efforts underway to define what that threshold is, but as of now, it's unknown. So WASH pathways to childhood undernutrition. So now we're going to the way forward here. So WASH pathways include repeated episodes of diarrhea, enteric infections, environmental enteric dysfunction, or EED, and time and financial costs associated with securing sufficient water quantities. So repeated episodes of diarrhea can lead to stunting and anemia. Enteric infections, these include bacteria, viruses, protozoa, and soil-transmitted helminths. Enteric infections can cause reductions in appetite, nutritional deficiencies, anemia, and exacerbate malnutrition. So another pathway is environmental enteric dysfunction, or EED, which results in abnormal changes to the small intestine. These changes can be structural, meaning that the villi and the intestine atrophy, so they flatten, and this reduces the surface area for nutrient absorptive capacity, and it also reduces nutrient absorption. The changes can also be functional, where cells are inflammable and permeable, and microbes penetrate the gut lining, resulting in chronic immune activation. So this simplified digestive tract microbial view of mucosal membranes. As you can see here, this is the this is the digestive tract, and this is like a cut of the mucosal membrane. As you can see, these ones on the left are healthy villi with tons of surface area for the cells, and the junctions are tight between the cells. However, with EDD, these cells become atrophied, losing their villi, reducing surface area. The junctions become faulty, and this allows bacteria, toxins, and undigested food to make it through the basement membrane and to the bloodstream. Another pathway to childhood undernutrition is time and financial costs associated with securing sufficient water quantities. So this is time spent, time a household spends collecting water, and the cost, whether financial or otherwise, for water, and also considerations for the opportunity cost. So what would they have done with that time and money otherwise? So based on these pathways, what are the recommendations for WASH programming? So these are to implement community-wide sanitation interventions, implement interventions aimed at supplying safely managed water services, reducing barriers to social and behavior change, promoting the use of WASH products and services that customers associate with social and economic benefits, and interrupt the fecal-oral pathways from geophagy and direct soil ingestion. So for implementing community-wide sanitation interventions, this means reaching ODF status in communities to achieve herd protection, meaning your exposure is limited in your community. And this is usually done through CLTS, but there are other ways to do it as well. They recommend professionalizing water service delivery towards supplying safely managed water services. So the end goal would be eventually have household pipe water and services that are professionalized and therefore sustainable. They also recommend reducing barriers to social and behavior change through delivery of aspirational products and services. So these are convenient and consistent water access, ideally household pipe water, but more generally trying to reduce the distances for water and time, and then increasing the quantity of water available. Providing appropriate wash products that are such as latrines or hand washing stations that are practical, convenient, durable, and hopefully affordable. They recommend using innovative SBC strategies and messaging. So these aren't just health messaging, but also addressing social norms, aspirational aspects of the household, and also tying it to one's identity. And that's why I put the FC Barcelona logo there. So another recommendation is to interrupt the fecal-oral pathways from geophagy and direct soil feces ingestion. So geophagy is putting things in, is when the child puts things in their mouth. This is the F diagram for both the sources of contamination, their vectors, and the exposed person. You take into account that exposure is not only from persons, which is usually addressed through ODF and sanitation marketing, but also there's a need to address livelihoods through agriculture, animals, and that sanitation is a community-wide. And that's at the sources, but also at the exposure points, at Save the Children, we use the clean household approach, which tries to address the household environment. So to give you an idea, so this was from a 5-hour observation at one household in Amhara, and these are all the items a child put in their mouth in those 5 hours. And as you can see, there's a lot of points of exposure, and children do like to put things in their mouth. There are multiple household risk factors that should be addressed. The ones in the bolded arrows are now considered to be more prominent, which include food hygiene, child spending time on the floor, contact with soil and animal feces, in addition to the usual hand hygiene and water management. So here's a quick review slide. And here are some WASH and nutrition resources where most of this information was from. And there's links in there. And I just suggest you all review it when you get an opportunity. Let's go through some experiences from growth through nutrition. So for WASH programming, there was community-wide sanitation interventions. These prioritized communities that were already ODF. However, considerations are for issues with backsliding as they're common. GtN worked on supplying safely managed water services through the construction of water points and multi-village water schemes, training of WASH codes and water utilities, capacity building for woreda water offices, and building the competency of TIVER graduates in the WASH sector, including for nutrition. They also work to reduce the barriers to social change and behavior change through integration of WASH, SBC, and agriculture. So you don't just wash your hands at your home. They also promoted the use of WASH products and services that customers associate with social and economic benefits. So this was the marketing of WASH products, including latrines and hand washing stations, and the integration of these WASH products with water supply activities and SBC activities. And to interrupt the fecal oral pathways from geophagy and direct soil ingestion, they used the clean household approach to reduce environmental exposures. This included food hygiene and household excreta management. So not for adults, children, and animals. So the whole household. Some lessons learned. I'll start with WASH marketing here. We learned that it was important to use different methods for WASH marketing and promotion, such as house-to-house visits, enhanced community conversation sessions, working with WASH goes and utilities for training, market days, etc. The enhanced community conversations are a good platform to reach most vulnerable households, as these are usually overlooked for WASH products and service promotion. Having a range of WASH products is very important, as well as having a consistent supply of the products, not just nationally, but also at the shop level, and along with having domestic manufacturing of those products. The WASH marketing strategy assumed that the households and the communities were ODF, or open defecation free. However, they should always be considered the considerations for backsliding and open defecation free status, and it's good to consider additional support for CLTS combined with WASH marketing. So though the project worked with the private sector for WASH businesses, it is important to involve the government in the whole process. And this helps make uptake and sustainability of the approach. Some lessons learned from water supply. So for multi-village water schemes, the activity originally focused on-spot water schemes, such as manual drilling, row pumps, shallow wells, and the project pivoted more towards multi-village water schemes, as these are considered more climate resilient and economically sustainable. We also had more simpler multi-point schemes that were solar powered as well, which could reach different parts of the community. They also started providing some household level connections, and in some cases, and provided broader coverage through these multi-village schemes, which is in line with the current recommendations. Growth through Nutrition is also trying to manage these household connections through the water boards and utilities to more professionalize the services. Shallow wells are fitted with solar panels, which are simple to operate and sustainable for rural settings. Okay. For hygiene, we learned that hand washing can be integrated into multiple channels and should be. So this includes parts of the intervention that beyond the WASH part, but also agriculture and livelihoods, animal rearing, cooking demonstrations. But the point is, hey, hand washing should be included at any opportunity where you should be washing your hands in any part of the intervention. We also learned the importance of including hand washing stations that are affordable and locally assembled. Has these sold very well in the project, and these also offer an alternative to basic tippy taps, which have a track record of not being used in the longer term. Food hygiene and wastewater management was also very important for infection prevention, and that these modules already exist within the Ethiopia community health worker guides. So recommendations from the project moving forward. The importance of multiple use water systems, to consider multiple uses and design of water schemes, and when feasible, along with MUS training, with multiple use system training, establish reporting mechanisms. Keep in mind that additional budgets are required for multiple use systems. There are also further opportunities for incorporating household water management and demonstration of water efficient technologies such as small drip irrigation, as well as further integration with water resource management and agriculture by using these systems. We also recommend to verify appropriate water treatment mechanisms in areas with water quality problems, for example, fluoride, and that these should be considered from the start of the project. We also recommend the development of national level rural water scheme construction guidelines, which can be easily adopted and within regional contexts. Also, policies assume that rural water scheme operation and maintenance is covered by user committees. This is not always practical, and we feel it is affecting the private sector who are interested in working in this space. Water provision to health posts and schools should be considered, along with methods for reporting. So if there are a lot of opportunities, especially in these multi-use schemes or multi-village schemes, to also include health posts in schools. However, if you're only recording number of persons, you're just making sure you have methods to report on that as well. There are multiple opportunities for working with the TIVET. So we work with the TIVETs for several parts of the GtN, but also including water quality management and water testing. There are opportunities to work on WASH marketing and product promotion, as well as working with them for operations and system maintenance, private sector opportunities, and partnering with them for the activities for providing the water testing services for the projects. If you all don't know, so plastic latrine slabs are set to be produced in Ethiopia. So these products are affordable, durable, popular, and they are transferable, meaning that they can be transferred from one owner to another, and are much easier to, if a household decides to upgrade their facilities, and as well as to transport and to clean as well. And we think this should be a focus moving forward, and figuring out the supply chains for those. Sanitation subsidies for the most vulnerable households should also be considered, as many of these WASH products are often outside of their financial reach. And finally, systems to track sales of improved WASH products and its installation, such as using a free digital data collection tool called mWater or Solstice, in order to track the WASH product sales and locations. All right, thank you. Vamos a ganarlo, gracias.
Thank you, Jason, for that very rich presentation. There are a number of questions that have come in for you, but I think we'll wait until after we've heard the presentation of Dr. Abdul-Halik, and I will now turn to him for his presentation. Thank you. Dr. Abdul-Halik, you may be on mute.
Oh, sorry. Okay, can you hear me now?
Yes.
Okay, so thank you for the introduction. I'll be, and Jason also for the nice presentation. Yeah, you have covered part of the introduction that I was planning to give. That will save me some time so that I can use it in the explaining the result part of my presentation. So I'll be specifically talking about some of the results from a recent assessment that we have done under growth through nutrition. So as Jason has described, there are lots of WASH related interventions that grocery nutrition is rolling out for the beneficiaries, one of which is constructing or rehabilitating water schemes so that to improve access of safe and adequate water supply to the beneficiaries which are targeted. So my presentation title is to look at functionality and utilization of those water supply schemes by the households. And as well, we have looked at how those water schemes are managed, what hurdles that the water committees do have that they reported. Next slide, please, Jennifer. Yeah, this has been said, both the direct and indirect effects of WASH interventions on both health and nutrition of a community, including children, women, which basically are the prime targets of the problems of malnutrition. So the direct effects being diarrheal disease, intestinal and parasitic infections, enteropathy, and as well indirectly time spent for fetching water, and also that translated into less time being spent to childcare could amount in affecting the health and nutrition of children as well as women themselves. Next, please. Well, specifically talking about the access to safe drinking water, according to a joint monitoring program report by UNICEF and WHO, so significant majority of the rural community does not still have unmet need for the safe and basic drinking water. That report only indicated, even though it dates back to 2015, I imagine that this number has improved a little bit, but by then only 30% of the rural population had access to drinking water. I mean, there are lots of various activities, both from the government side and non-governmental organizations, one of which for the first the flagship program from the government of Ethiopia, which is supported by different development partners, is the One WASH national program, which is focused on primarily improving the coverage for access to safe water and sanitation services to the overall community in the country. So it is implemented in aiming to address the challenges towards achieving improved water and sanitation services. The second growth and transformation plan also had an ambitious target of having that coverage being reached up to 80% of the population in the country. Next, please. So I might not go in detail about gross nutrition. Jason has given us a very detailed description about what is being rolled out as in terms of WASH interventions related to WASH interventions under growth through nutrition. So I'll skip to the next slide, please. So with this in mind, we had set up a brief assessment to look at whether, I mean, there are a number of water schemes being built, newly built and rehabilitated in the communities that are targeted by growth through nutrition. So the primary objective that we had while we're conducting this research was to look at whether they are functional as they were planned to, and how the community are experiencing in terms of utilizing them, and as well what improvements are there in terms of utilization and access to water sources. And we have used a mixed method approach whereby we have interviewed targeted households, especially women in the households whom we think are have responsibilities in most of the rural settings about water management in the households. And as well, we have key informant interviews from the Woreda water health officers, and as well people who are engaged in managing the water schemes at the community level. So in that regard, we have assessed their experiences and as well what hurdles and challenges do they have in terms of managing the water scheme so that they can keep them running functional and sustainable. Next, please. Yeah, to give you a bit of a highlight about the findings. So the first bar chart tells about the general source of drinking water in the households that we have investigated. So the majority of them access water from hand pump shallow wells, followed by those piped water. These are multi-scheme waters through pumps that they can also access it in their dwelling. As well, most of the constructions or rehabilitated water schemes by growth through nutrition as presented by the pie chart are hand pump shallow wells and as well piped water, which can extend until to the yards in the dwelling. Next, please. In here, I have tried to present the purpose that the households use the water for, apart from drinking, which all of them use the water sources for drinking. They also use them for personal and environmental hygiene purposes like cooking, and also showering, washing clothes in the household. Some of them have already reported to use the water for gardening some vegetables in the yard. And majority of them actually store the water in capped vessel plastics, but some of them also reported to have used clay jars, which do have a cover that implies that they can safely, they are able to safely store the water. But apparently only 6% of them reported to have used to have been using any kind of water treatment before drinking. Next slide, please. So this table, so we have tried to ask them whether there were improvements after the construction of the water schemes in their village or in their surrounding. So as I have said, majority of them who are responsible to fetch water in the households are adult women. If not, if it's not adult women, the next are female children. And those adult women reported to that the accessibility has improved after the construction of water schemes by growth through nutrition in their village. Also, they reported to have the water regularly from the source in the water schemes. And almost 2/3 of them say that the water is adequate for the household needs. But for those who reported for the water not to be adequate also have mentioned some reasons, which are to be long waiting hours in the water points, and as well a little bit of travel, distance from the household. Few of them, sometimes there are restrictions in the amount of water that they fetch at one round, so that happened to be reported also as one of the reasons for not having adequate water at the household. And of course, a significant majority of them also have reported for their personal hygiene to have been improved after the construction of the water schemes through improved hand washing, that they improve their practice of washing, keeping their children clean and keeping their clothes clean, by using the water from the sources constructed. Next slide, please. And as well, about 56% of them have reported to have saved time compared to the before the construction of the water schemes. And we happen to ask them what activities that they use for, in the time that they have saved. And most of them reported to you that for childcare, food preparation, and engaging themselves in, since it is in rural settings, they engage in agricultural activities. So we have tried to ask them what the time that it took for a round trip to fetch water in the earlier time, and compared it with what they are experiencing now. And in total, the average time that they have saved and including average trip that they make per day was twice, and in total that they have reported to have saved 60 minutes per one round trip, for which accounts for the travel and waiting time to fetch water. So if a household in minimum travels twice to the water scheme, that means that they have at least saved 2 hours or 120 minutes after the construction of the schemes, which they have reported to use this time for more childcare, food preparation in the households, and engaging themselves in different activities. Next slide, please. And we have also made direct observations on the constructed water schemes to look at different parameters, one of which was whether like the flow rate of the water from the schemes. Majority, of course, from the schemes that we have observed, around 18% of them were not functional at the moment. That means that they, at the time of observation, the schemes did not have water running for use. So from the remaining 55 schemes that we have observed, about 58% of them had good water flow. That means we have measured this through how long it takes to fill a 20-liter jerry can, and in significant majority of them, it takes only less than 1.5 minutes. Similarly, the water quality in terms of whether the water has color, odor, or taste, majority of them have a good water quality based on these 3 parameters. Next slide, please. And also from our observations, which most of the water schemes that we have observed are newly built ones. The rehabilitated ones are about 1/3 of, 28%. At the time of observation, as we've said, majority of them were functional, and they do have an opening schedule, so that which is good for the water schemes to, up running functional for sustainably, to be monitored in a strict schedule. And also majority of them do have water committees who are responsible to manage the water sources. By managing, we mean that to look after whether there are fences around, and there are, in most of the cases, they collect fees, a very reasonable amount of fees, which they later on use that for maintenance purposes in case there are problems with the functionality of the water schemes. But only about 60% of them reported to receive support from the woreda officials in terms of managing the schemes regularly. And also less than half of them reported to have any member in the committee who is able to repair in case there are any problems with the schemes. But we have tried to look at the composition of the WASH codes, how women are embedded in the membership. Most of the average number of members in the committees are around 7, and the average number of women in the committees happen to be around 3 in the WASH committees who are managing the water schemes. Next slide, please. In our analysis, we try to look at also what factors determine the functionality of the water schemes, even though we did not have a very adequately powered sample, but we preliminarily tried to look at that newly constructed ones, those schemes which do have a strict schedule of dispensing water for the beneficiaries, and those who are among the WASHCO members who have adequate skills to repair and maintain the schemes do seem to be more functional than their counterparts. But the most important finding here is those who get regular support in maintenance happen to be significantly, to be very functional in running, being functional compared to those who are not getting regular supports. Next slide, please. To look at some findings from our key informant interviews. So most of the findings also complement what we have got through the household interviews. Most of the reports indicated improved accessibility. We can see the codes from, these are direct codes from the WASHCO members or the woreda, water office heads. So we can see the first code that previously it was very difficult to get water during dry season, especially. So we couldn't get more than 2 jerrycans per day, and it took us more than 6 hours to fill. So in addition, our cattle suffered because of lack of water. But however, after this water scheme, we can easily get water, and we now get 8 to 10 jerrycans per day. So from this code, we can learn that it has improved the accessibility and as well the amount of water that the households or the beneficiaries are getting. Next slide, please. In terms of saving time, also the qualitative findings support what we have seen earlier, that the participants reported to have more time that's saved compared to what used to be before the construction of the water schemes. And also they have explained how they are using those saved times and better health outcomes. And as well, here they have reported that previously they were using water alongside, the same source as their cattle are drinking, so that, and they have reported that they used to have regular health problems, but now which have decreased in terms of occurrence, which happens to indicate also a better health outcome. Next slide, please. And the same holds true here, also improved personal hygiene and change in the utilization of water through increased amount of water used in the households, and as well improving different personal hygiene practices at the household and individual level. A woman had reported, a woman member at Bulbulu in one of the study sites, she reported that we are keeping our and our children's personal hygiene, since we have got adequate water for washing clothes, taking shower, and also saves their time for their domestic work. Next slide, please. So in terms of managing the water schemes, the WASH committees, the WASH members have indicated the different ways of managing the water schemes. One way, one important thing that they have indicated was to set guides and rules how the community or the beneficiaries need to utilize the water sources, and creating a sense of ownership. As part of that, they charge some reasonable amount of fees, which they put it in a saving or credit bank account, which they later utilize it for maintenance purposes. In one experience, we have got a report that a WASH member saying that we have 16,000 birr capital, which we have, which are saved in a saving and credit bank, and will be used for maintaining the fans and other things. When the water scheme is dysfunctional, the technician from the woreda come and maintain it. That means that they will use this money to pay for the technicians, whoever coming to maintain the schemes. In some cases, still they are struggling how to figure out how they can discharge or this payment. In one case that they said, although we have discussed within the committee how much money the households have to pay for each jerrycan of water, we did not start to collect the money yet. Well, there are some reports from the beneficiaries as well, and for the reasons that we will see later on in the challenges, in irregular fees which are charged for the beneficiaries might also be a problem in terms of utilization, and that might lead to the households to resort to other source of less safe source of water. Next slide, please. As main challenges, it's been reported that basically when the water schemes go or they are broken or not giving or when they are running not functional, the problem that they usually face is in terms of maintaining them, because of not having the spare parts markets or the available spare parts being expensive. And as well, some of them also have reported to have less training in maintaining the water schemes. In one case, respondents say most of the time the training focused on water use, jobs, accountability, and responsibilities of the committee member, and we did not receive enough training on the maintenance. And in some cases, they have indicated for the training to be given few selected member of even the community. So whenever there are changes in the committee members, it would be good to have someone who is skilled enough to repair them in the community. Next slide, please. Here I have just briefly listed down some of the challenges that we have got from the reports from the respondents, like lack of ownership in the communities to manage the water schemes, to keep them running, so that this could affect the functionality, obviously. And in some cases that they have indicated, handing over of the project is not done properly, so that they did not feel or they are not much aware of how to manage it, and as well it did not create the sense of ownership. Poor participation of the WASH committee members in some parts of the schemes also had a problem in affecting the functionality. Limited supervision from woreda officials who are supposed to be giving them regular supports in managing and Also capacity building through for their maintenance skills also was mentioned as a major challenge. Topography and also inconsistencies of payment or water fees. These two are reported to have affecting utilization of the water sources by the households. Next slide, please. Well, in summary, the assessment indicated that most of the water schemes were running functional, and they have, they are reported to have improved the access to safe water. And in some cases, of course, distance, waiting time, and amount restrictions have led to inadequacy of household water need. And also we have learned that the construction improved though evidence that improved personal hygiene. Next slide, please. Well, it's been evidenced that there is a significant amount of time saved for the woman to invest that time in childcare and other household activities. And also it's good that women are involved in the management of the water schemes. And also what we have learned is a very strong support to the WASH schools in the management would also result better functioning of the water schemes, and that can be translated to better results, overall results that the constructed or rehabilitated water schemes are intended to bring into, which are improving the health and nutritional status of the beneficiaries, especially the women and children. Next, please. Well, these are just to show you some of the scheme pictures from the observation. Next. Next. Yeah, finally, I would just like to acknowledge the study participants, all the study team, data collectors, and the grocery nutrition field and country office staff, and also you participants for your patient listening. So sorry if I have taken a few more minutes from the allotted time. That's all my presentation. The next slide is important, which is a message related to the current situation we have. We need to abide by the rules to prevent the transmission of the pandemic. Thank you for your patient listening.
Thank you, Dr. Abdulhalik. That was a very good summary of a complicated set of components and questions that were asked in the WASH study. Now, we're fortunate, in addition to having our two presenters, we have someone else who has joined us, and I appreciate this, Ashalo Sadili, who is the Senior WASH Advisor for Growth Nutrition. And I wonder whether, before we get into the general question and answer period, whether there are some comments you would like to make on the two presentations that have just happened.
Thank you. Actually, I don't have a major comment. We were working together, so all issues presented are things that we agreed. So I don't have any specific comment on the presentation. If there is any issues that need my response, I will respond. Thank you.
Thank you. I'm glad you're going to stay with us on this. I should also mention that one of the papers that Dr. Abdulhalik mentioned earlier, you are a co-author. Thank you. So let me start with some specific questions to the presenters before we get into some general issues related to WASH. Jason, we had a couple of participants asking questions about the WASH links to wasting. Can you speak to that issue?
Sorry, I was on mute. Yeah, so there are many links to the pathways. The pathways also link to, that we mentioned in the presentation, also link to wasting. However, the focus of the presentation was more on the stunting side of things, and which is more in line with the growth through nutrition product. There is a need for research onto what are the most effective interventions to address wasting, though. So it's something in progress.
Thank you. There also was a question, Jason. I'm going to go through one specifically with you, then Abdu, and then get into a general discussion, if that's okay. You mentioned in one of your slides that there was a 31 to 35% effect of WASH on reducing stunting. Question was, from where do those data derive? What is it? One research study, or is it a series of research studies?
Those data were pulled together from, I think it was 3 studies on that slide. I will emphasize that those are very estimates, and actually somebody in the chat even posted an article they found that might be more that might be newer. But yeah, those are more rough estimates. I wouldn't make any bets on them per se.
Well, that's fair. I mean, this is a difficult area. That's fair enough.
Yeah.
I appreciate your honesty on that.
No, yeah. Sorry if I didn't make that clear, but it was just to paint a picture more than anything. Yeah.
This is, as we know, in dealing with these types of implementation, it often is not an exact science. So thank you. The other issue of one of your slides talked about one I suppose policy approach is to prohibit open defecation. And as I looked at that, we were involved under, again, a USAID funded project, Nutrition Innovation Lab in Nepal, where based on our research, but many other inputs, the government of Nepal passed legislation banning open defecation. But the issue was not so much the legislation, but rather enforcement of that legislation. And I wonder, I know you handle the globe. It's not specific to Ethiopia, but and other people, Abdu and others weigh in on this. But has what happened in Ethiopia? Are you aware of how that is enforced?
It's a good question. I might let Ashalu provide more detail, but in general, through CLTS, the community decides their own enforcement methods. And that can range from something that's more of trying to make it more of a social norm. So as everybody's kind of policing each other, all the way to actually having fines in place and a system of ticketing. I'm not sure exactly how this has been, what are the different ways it's been done in our project areas.
Ashalu, do you have any more specifics on that? Because I know you have much more experience in Ethiopia.
Actually, through GtN, we don't have support for CLTSH, but we are working with the Woreda Health Office, and we provide capacity building training for health extension workers. And we are trying to address this issue through the health extension workers. Otherwise, the project has no direct support for CLTSH. We are focusing on promoting improved WASH products. And actually through ECC, through our ECC sessions, we aware our beneficiaries to have basic sanitation in addition to the effort of the health extension workers.
Thank you. That leads into my next question. A number of issues have come up related to SBCC, and this is a question for all three of you, please. Can you talk specifically about where a SBCC intervention has worked, and what was that intervention, and what was the specific outcome that was targeted?
Can I go ahead?
Please.
Yeah, okay. So, well, different evidence indicates that a combination of WASH interventions along with SBCC interventions, tend to result in positive health and nutrition outcomes. But if you also remember our recent study, which looked at SBCC, the effects of SBCC interventions in a range of nutrition indicators among women and children in our project targeted beneficiaries, indicated that there has been significant improvements in WASH practices in the households. I mean, when there was actually a combination of the interventions, SBCC interventions in the households. So that means that along with the WASH interventions being rolled out in through growth through nutrition, complement from SBCC interventions can really plays a positive and significant role in improving WASH activities at the households. That's one thing that we have learned from our project experience, which we have actually identified through an operational research from the project.
Anybody else want to weigh in on that one?
I'll also add, and as an aside too, I suggest people also start looking into opportunities for using SMS or digital messaging as well, as there's been some SBC activities I've seen that have had just a significant behavior changes just through text message. So keeping those into as an approach is also for something to be considered. Mm-hmm.
Okay, I think this one is for Dr. Abdulhalik. Can you clarify where the non-functional schemes are located, and if are they located in woredas where the program has exited? I think you talked about 17% of the schemes being non-functional.
Yeah, around 12 of them. I cannot say by heart. I cannot remember them by heart now, but we have the data to know from which woredas those non-functional schemes are existing. We can clearly identify them through from our data.
Okay, I think Jason, this next one is for you. Are there examples of where subsidies, this is for one of your slides, I think, are there examples of where subsidies have been provided to the most vulnerable households? And you might explain what the most vulnerable household is.
So the most vulnerable households are those of the least amount of means, or from a like a community that's it's a minority community or a single parent household. So these are usually ones who have more difficulty getting access to these WASH products. One example, the best example we've seen from subsidies for sanitation was from Cambodia, where they subsidized some of these. They were able to subsidize the most vulnerable households. However, keep in mind that they do have a system, an ID system to help identify those most vulnerable households through the government, which was a big enabling factor for selecting the households. But there was some good research and interventions from Cambodia on it. Mm-hmm.
Thank you. This could be a general question globally or specific to Ethiopia, which obviously had a series of multi-sectoral nutrition plans. If you take the most current one in Ethiopia, or Jason, in your case, since you handle the globe, how prominently do WASH schemes play in these multi-sectoral plans? And are there specific dollars identified for WASH? And where, this is a multi-sectoral question, so prominence of WASH in multi-sectoral plans, dollars allocated to WASH, and who funds this?
The integration of water supply into multi-sector nutrition programs is quite limited. WASH is very usually present, especially on the hygiene side and often sanitation as well, but water supply, not as much. I think at least that a lot of it has to do with the cost associated with those water projects. There is a move towards integrating more WASH, but not just water. Sorry, integrating more water supply, but not water supply alone as well. Also, water supply for water resource management for agriculture and livelihood as well. So these things are going to start overlapping more.
And Abdu, particularly, I mean, in the case of Ethiopia, how prominent is WASH in the Ethiopia plan, and also funding for some of what you presented?
It's obvious that WASH, special nutrient-sensitive WASH interventions are part of different projects which are being implemented to target undernutrition in the Ethiopia. So it's obvious, like that of our growth through nutrition projects, other projects, and even as I have mentioned, the government has a very big flagship program targeting challenges related to access to safe water and sanitation services, so that to improve those problems. I'm not sure in terms of who are funding those activities, but most of the development partners who are working on health and nutrition do have WASH interventions accompanied or along with other interventions that they are rolling out in the community.
Reason I ask this, and it comes up a lot, is in the work, not only in Ethiopia, but in the work under Engine, the predecessor project, and also in the work under Growth Through Nutrition, what came up from policy officials, including very senior policy officials at national government in Ethiopia, was that one metric or one litmus test of the seriousness of commitment to whatever, but let's say the seriousness of commitment to nutrition is a particular line item in sector budgets for nutrition. And I suppose we could then say the same thing for a line item for WASH activities in sectoral budgets, because it's a signal that this is seen as important, but that's a longer discussion. This next question are to the three of you. How are WASH activities monitored on an ongoing basis?
How are WASH activities monitored on an ongoing basis?
Correct.
Ashalu, I don't know if you have any examples of how we did it for growth and nutrition specifically, but in general, it's usually it really varies on the different aspects. So for hygiene, usually household monitoring. For sanitation, there's a push to go beyond the household to do a community level monitoring. And for water supply, it's more similar to the presentation that Abdul Khalid gave. Mm-hmm.
Thank you. Actually, the WASH activity is monitored at the other nutrition activities. We do have joint monitoring, regular joint monitoring with government partners, especially at woreda level. The woreda water and health offices monitor the progress of each activity. We also report to regional and the national level WASH actors the progress of the project. And we have also DHIS just to capture the data of WASH related data in areas where we implement, and we also do field level assessment to monitor the progress. Actually, for GtN purpose, even the donor recruited consultant to monitor especially the construction quality of water every week. So we do have a strong monitoring mechanism for, especially for the water scheme construction. Thank you.
Thank you. Another issue, and this I have to say was not specific to either of the presentations, but in Ethiopia, pastoralists present some unique challenges as far as WASH activities. Are there any particular projects or activities going on focusing on pastoralists? And what have you found to be the results of programs, projects targeting pastoralists, if any? I haven't seen much on this, but so anybody who wants to jump in on that. Jason, anything you're aware of in countries other than Ethiopia?
None that I've worked on, but I do know that it is a challenging environment to work with, mostly because of the nomadic nature of a lot of times of working with them. It's hard for them to have an improved latrine, and water access is, of course, fixed water points are also difficult. So I also think there was a project in Ethiopia that was starting to work on this, but not GtN. A lowland project was working on this in Ethiopia.
Dan Abbott just had an intervention. Thank you, Dan, that the pastoralists have not been a focus, but sorry, Abdu, go ahead.
Sorry,
So,
can I? Okay.
Yeah,
Please.
as part of the One WASH national program in Ethiopia, it's working in 4 pillars. So with a primary objective of achieving, having or improving the coverage for access to safe water, safe hygiene and sanitation services. It works in 4 different pillars. One is improving that access of water and sanitation services in rural and pastoral settings, along with improving it in urban settings and as well institutional WASH activities. So the program targets also pastoral communities and improving the access to water and sanitation services.
Thank you. Another series of questions that I put under the umbrella of equity, and we can start with the Growth Through Nutrition project, but I think Jason more globally. First of all, who has benefited from the series of WASH activities under GtN? Was it pro-growth? Was it more the poor, or was it the better off? And then a broader question, how does one create ownership of these activities over time? So who benefited most up to date from the WASH activities in GtN?
I would say the poorest or most vulnerable households would benefited the most. In general, these projects are able to target those. With, however, I'll note that with the exceptions of community sanitation, which needs to target all households regardless of their income, because everyone is exposed regardless of your neighbor's wealth or your wealth. And then the other one was for the WASH marketing products. Those have a more also, the target is also community level WASH. So often the more wealthy households usually access these products first, but over time, and there's been research to this even in Ethiopia as well, that over time these products make it to the community more at large.
Thank you, Jason. I wonder, and I mean, a part of a question from Emily is there anything you would recommend in the future to improve buy-in to these schemes and therefore increase the likelihood of sustainability?
Ashalu might have some stuff to add here, but a big part was, a big part was community involvement with the government from the beginning, as we mentioned. Ashalu?
Yeah, just to add one point on who is benefiting from GtN WASH project. Actually, we are trying to reach all community. We don't have a specific beneficiary. We are trying the whole community, especially in promoting the sanitation component. But when we do this SBCC, we focus on most vulnerable households because those are mostly ignored. So we focus on that. And as Jason said, we are not giving freely the products. So people who have capacity purchase the products first, and they may be the first beneficiary. On the ownership, from feasibility study, we involve the community and the local government. So it is the community who take over the schemes after the project phase out. We also provide capacity building training for the Woreda Water Office just to give backstop support for the WASH costs and rural utility. So it is the community responsible to take over the schemes. And we are also linking the WASH costs with the private sector for spare parts supply and to get maintenance service. So those are the mechanisms to create ownership in the community after the phase out of the project. Thank you.
Thank you. A very specific question, Abdu, for you, I think. You had duration of construction as one component of determinative functionality. Can you explain why that was put in there, what the relationship is?
Yeah, thank you. Well, that was to look at whether duration of construction, the time since schemes were constructed had anything to do with the functionality of the schemes. It happened to be, well, it did not happen to significantly affect the functionality of the schemes, even though we saw a little bit of improved functionality among those which were, recently constructed schemes, but the difference was not that much significant in terms of functionality of the schemes. So the duration, that parameter was also assessed whether if it affects functionality of the schemes or not. So this tells us that so long as the water schemes are managed well and owned by the community, and also they are able to skilled enough to maintain whenever there are problems with the schemes, and the duration might not be that much of a problem.
Thank you. I think this next one also, Abdu, maybe for you, but did any of the activities under growth through nutrition WASH, did any of this affect water availability at the level of health centers or health posts?
From this data, I cannot say whether water availability was improved or affected in any way at the health facilities. Most of the schemes are targeting communities to benefit from the schemes. I'm not sure. I don't have data on this. If Aschalo can say a little bit on maybe.
Yeah, actually, growth through nutrition WASH project is designed for community to address the problem of the community, but in the middle, we revise our strategy. Just as Jason presented, we shifted from on-spot water scheme approach to multi-village. So when we revise our strategy, we try to include institutional WASH. Actually, we don't have separate budget for institutional WASH, but when we construct the pipeline, if there is a school or health institution in the way, we provide water for the institutions as well. So now we do have a lot of schools and health institutions benefited from this community water supply. Thank you.
Good. Around or about these questions, this is an interesting one, I think, for the three of you, please, but is stunting an appropriate indicator to use in order to measure the success of WASH? And if not, what would you say are the top 1 or 2 key indicators to look at WASH schemes? Anybody, any of the 3 of you could jump in on that one. Is stunting a good indicator to use? Jason, go ahead. I'm sorry.
Stunting, for the time being, is a good indicator, but beyond stunting, we should also look at the cognitive development parts of it. So it's they can, in the end, that's the real thing you're trying to address. So in addition to stunting, that could be measured. There's also the newer approaches go beyond just the stunting to also consider opportunity cost and time spent, and water for water, as we call it. Just the fact that having access to water is important for being able to make a livelihood, and it affects all the other hygiene behaviors as well. So I think we're starting to measure beyond just stunting.
Mm-hmm. Yeah. Abdul, want to say anything on that one? Abdul Halik, do you want to comment on that or pass? I wonder if he's frozen. Anyway, well, let me then ask a question now that's specific to GtN. How will GtN hand over the overall monitoring and management of WASH activities once the project's over? Charlotte, do you feel comfortable talking about that? Okay. I think you have a year to go, but how will you hand over in GtN?
The WASH component.
Yes.
As we said, for the WASH, for the promotion of improved WASH product, we are working with the private sector just to ensure sustainability. The private sectors are already people who are working additional work, so we don't have any problem of sustaining the improved WASH products through those private sectors. And now we are looking that we established the supply side, and there are people who are creating demand at the grassroots level. So even without the presence of GtN, this system can continue. Regarding the water supply, when we start implementing in one woreda, we sign a memorandum of understanding with the woreda water office, just to take over all water schemes constructed in that woreda after the phase out of the project. So it is the woreda water office responsible to give support for WASH costs. We establish and train WASH costs for each water schemes, and we monitor and give support during the project period to collect water fee, to have a well-organized system of water management system. So now most of our water schemes started collecting fee. So this fee will be used for operation and the maintenance cost. So our strategy is establishing WASH costs to take the management part, and the woreda water office to support them to sustain the water scheme. So this is our strategy, how we phase out from those woredas.
Thank you. We're almost out of time, so I'd like to pose a question and ask the 3 of you to maybe have a 60-second comment. There are so many components that come under the umbrella or rubric of WASH. From what you know, either in Ethiopia or elsewhere, what would you consider, quote, the best buys if you had to invest in something, the best buys for investment in WASH? Abdul, can we start with you?
Can you hear me? Hello?
I can hear you now, yes, yes.
Okay, sorry, earlier I had my internet interrupted. So can you just repeat the question, please?
Yeah, WASH includes so many different components, and under the assumption you can't do everything all at once. From what you know, what are the best buys of investment from the point of view of improving health and nutrition? I think, okay.
Yeah. Well, so I mean, we have learned a lot. I mean, along with the different reports in terms of the effects of WASH interventions, whether they improve nutritional status of children or not. But we have seen other significant reports, positive reports as well, in terms of not single interventions, rather combined interventions of WASH, resulting in positive health and nutrition outcomes. So I would suggest, from the evidence we have at hand, I would suggest a combination of WASH interventions, not a single-handed WASH intervention strategy, if we are seeking for a positive improvement in health and nutrition of children or women.
Thank you.
That's reflection.
Thank you. Jason?
Yeah, I'll start with water. For water supply, just working towards the end goal and this is talking about designs and budgets, but working, maybe not achieving, but making designs of water systems that allow for household pipe water connections. So setting that long-term goal in designs, and with considerations for climate change and for multiple uses of water, and also public and including public facilities and schools in there, along with the maintenance mechanisms for them as well, as these are usually can help motivate the private sector and have a basis for maintenance through these public facilities. For sanitation, again, these wash product, having these local wash products is a big focus, and having them be something that's accessible, affordable. The Toyota Corolla of latrines. And then for hygiene, I think there's trying to move away from just tippy taps into more. We've tried new things like these hand washing stations that are being marketed, but just trying to find alternatives and hand washing and points. And finally, the importance of food hygiene. Food hygiene wasn't necessarily something that's been emphasized previously, and we've learning that it's a big component of environmental household health.
Thank you. And last but not least, Shallow, you have a
thank you.
comment?
Yeah, my comment is every WASH activity should be demand driven. There should be strong demand from the community, and we have to ensure this before constructing the water scheme. The other is we can invest on the water on sustainable and reliable water source, but we have to involve the community to play their role, especially in doing the hygiene and sanitation component. In some, there are good experience that before constructing the water schemes, we can put as a precondition community to have latrine and washing facility before constructing the water scheme. So in this way, we can reduce the amount of budget that is required for WASH. The other is whenever we design a water scheme, it should be based on the community demand. For example, if it is a pastoralist community, we have to include cattle trough when we construct a water scheme. Otherwise, the pastoralists give priority for their livestock before domestic need. So every demand of the community should be assessed before designing a water scheme. Those are major recommendations.
Thank you. Well, thank you. We're running out of time, so let me just thank the two presenters and commenter involved in this. And I'm struck. I've been involved recently in a lot of activities around food systems approach to improving health and nutrition. A lot of this, there'll be later on this year, a United Nations Food System Summit. And I'm struck by how little in this whole domain of food systems, how little emphasis yet has been put on water or WASH. And it's presentations like this, which really are elucidate a lot of the complex issues. And I would add, from my own personal perspective, we need to use these kinds of data presentations much more for advocacy to get the WASH agenda higher on priorities in looking at a food systems approach. So with that, I will end this. But thank you all. Thank the participants for wonderful questions. And this will be available online, the recorded presentation for everyone. So thank you and enjoy the rest of your day.
Thank you everyone for attending.
Thank you.
Thank you all.
Thank you all. Have a nice time.